from Dianne in Missouri, talks about how her sleeping routine has changed since the diagnosis with sleep apnea, teeth grinding, and unable to sleep, which of course would probably lead to fatigue. Nichole in Kissimmee, Florida, who talks about symptoms that are most impacted her around muscle pain, stiffness of the thighs, shoulders, neck, severe scalp issues, and flares of skin rash on her torso and hips. Felisha in Silver Springs talks about, on her best days, she says, DM affects my ability to comb my hair, something that I don't worry about much, but on my worst days can cause challenges. It impacts my ability to function in society. Erica in Dallas also talks about being diagnosed with juvenile dermatomyositis at 4. I was in and out of the hospital, then many years on prednisone. Her DM has stayed, she says, has stayed on the back burner for the most part. She's now 43, and she feels like it's coming back. She's constantly in pain, significantly tired with no strength. Gina in Williamstown, New Jersey, talks about extreme skin itchiness and rash for almost 2 years before treatment worked, soreness in her mouth, and couldn't grip things, and lost almost half of her hair because of the skin issues. Marcos in Mexico, I was diagnosed with dermatomyositis in 2021, and I still have symptoms such as calcifications. Magdalena in Mexico also says that I'm very bothered by sciatic pain that goes down from her buttocks all the way down to her leg and foot. Peter in Las Cruces talks about being an MDA5 patient. Was diagnosed only a year ago, but suffers fatigue and difficulty breathing. He's now in multiple therapy regimes, and his doctor tells him that his lung function is not good. Shaylie from New Delhi says that I am not able to stand up from the floor due to leg weakness. Holly from Yardley, Pennsylvania says, my voice and swallowing. As a singer and a musical instrument player, I have been robbed of my ability to sing effectively, for hire, and play all of my chosen instruments, harmonica and many others. My ability to breathe due to a non-functioning soft palate causes me no longer to be an effective public speaker. I'm also an actor. It's been heartbreaking not to make music for myself or as a career. Anne Elizabeth in France, who says pain management and moral well-being are what has affected her life, which is a new one that has not come up in terms of the issue about pain and pain management. Nichole in Florida, I have developed depression due to the significant impact on my previous lifestyle and therefore quality of life, anxiety around treatment regime, and corresponding loss of flexibility in day-to-day life and in limited social life. Holly in Pennsylvania, my concern is that I age is longevity and my ability to stay independent and productive. We also have Nichole talking about what worries and frustrates me about my condition is the lifelong need for treatment that limits my ability to work and live a life. Arlene in Abington, Maryland, my largest concern is my lung health. Knowing the interstitial lung disease may not respond to medicine if it goes to rapidly progressing ILD. It increases my mortality rate. We have Nichole from Florida who talks about IVIG. She says, IVIG treatment has moderately improved both muscle and skin symptoms. Lynn in Statesville, North Carolina, I'm currently taking 4.5 milligrams of low-dose naltrexone daily for my dermatomyositis symptoms prescribed by my integrative medical doctor. It appears that to be working very well. All my symptoms are managed with no noticeable side effects, although my new primary care physician has requested that I not take LDN as the off-label use for dermatomyositis is not FDA approved. Magdalena in Mexico. I am almost in remission, although I still take 1 tablet of Myofortic daily. I stopped prednisone a year ago, and since that time I've had muscle and joint pain, perhaps due to the lack of steroids. Robert in Eagleville, prednisone is a wonder drug for me, but I worry about how long it is wise to be on it. I have Dianne in Missouri. What frustrates me most about current treatments are the side effects. I never know when I will have immediate diarrhea. The prednisone, I have been on for 4 years, may be impacting my bone health, and I have osteoporosis now. And I've also been misdiagnosed with eye problems due to hydroxychloroquine, sorry. It's a constant worry that I'll either flare again or that the medication will lead to more conditions and more medications. Peter in Las Cruces, New Mexico, having to use oxygen all the time. It's a big burden, plus I need to have therapy with IVIG twice a month. So again, we're hearing the story about IVIG, the good and the bad, the lack of quality of life depending upon how long you have to be on IVIG. And Elizabeth in France, what she worries about are the withdrawal symptoms from certain analgesics, sleeping pills, and other antidepressants that must be controlled. Another one of those side effects of the disease. Let's see. Oh, there's so many here. Jean in Williamstown, New Jersey. After 10 years of remission, I had a flare of dermatomyositis in June of 2022. Every approved treatment was tried with no success. Symptoms included severe skin inflammation, burning mouth syndrome, swelling of eyes and fingertips, severe scalp itch and loss of hair, extreme tenderness that made grasping objects very difficult, and painful swelling of cuticles. Let's see. Lindsey in Minneapolis. I had a rare reaction to CellCept called paradoxical acute inflammatory syndrome. Because of the rarity of the reaction, it took a lot longer for my team to figure out that the CellCept was actually doing harm to my body. It set back my treatment significantly, close to 1 year of debilitating setbacks. I think that. Ashley and Fairbanks. I would like to see a therapy that would work for our immune system, not destroy it, and to halt the progression of the disease. And Shally in New Delhi, there should be medicines for myositis with minimal side effects, and we've talked about that on our body. Less toxin load on liver and kidneys and other organs. Mark in Seattle, Washington. I'm participating in a clinical trial, but I haven't seen improvement in my symptoms. Unfortunately, if this study drug isn't effective, I've potentially lost 2 years with no improvement to my condition. I find that this time frame is unreasonable and unfair to patients, and my quality of life has declined.